Well, a pleasant good afternoon and welcome to this special presentation of Cloud 9 on ACT and The Voice. We hear a lot of half-truths these days in our society. I have no idea what half-truths are. Is either it's truth or not. But for some reason we get comfortable with half-truths and all we end up having is confusion. So I've been hearing a lot of half-truths about the H1n1 virus, or as we know commonly called swine flu. Yeah, but I wanted to dispel the myths surrounding the H1n1 virus and really educate the public on what exactly is this flu virus, and give you some really strategic pointers moving forward, so you wouldn't be living in fear as it pertains to H1n1. Joining me right now, good friend of mine, specialist in internal medicine, Dr. Teelucksingh. How are you, sir?
Fine, thank you.
It's been too long.
So it's a delight as always, Chairman.
It's been too long, and I'm really grateful for you joining us today.
Thank you for having me on the show.
I'm joining you right at your workplace, at your office.
Welcome.
And Happy New Year to you.
Same to you and your family.
So let's get right to it. The H1n1 virus.
Yeah.
Before we get in, let's deal with what the virus is first of all, before we get into the myths surrounding, because I'm hearing all sort of things on the radio. People calling in, some saying that, they hear you could die in 24 hours, different things. So the H1n1 virus, what exactly is it?
So I'm glad that you've actually brought this to the forefront, so apart from the fact that it seems to have created a great deal of panic following some deaths. So it's actually one of the flu viruses. Most of our viewers and listeners would know about the influenza virus, and infections with these flu viruses, and usually you have A and B and different strains of the virus. So the H1N1 actually stemmed, and a lot of interest actually surged from 2009 when there was a global epidemic that started in Mexico, affected other parts of the world, including the West Indies. And these viruses tend to change or mutate every year, which is why one of the things that we always speak about is the need for a flu vaccine or an influenza vaccine every year because of the changing structure of the virus. So it's the influenza virus, which has been around for hundreds of years. There have been epidemics. In fact, I was reminded that actually there was a huge epidemic at the end of the First World War, which was 100 years last year. So 1918, there was a huge epidemic following that. We heard about the 2009 so-called swine flu, which was that structural form of the influenza virus in 2009, and we've had a few cases over these last few years. The structure of the virus changes. It's an influenza virus. It's spread not by having pork or pork products. It's actually spread by droplets in the atmosphere. If you inhale droplets from someone infected with the influenza virus, and as I said, it tends to peak with the onset of winter in North America and Europe. And of course, we know the world is a global village. So a lot of persons will tend to bring in these viruses, whether they make trips into those areas or as part of the carnival season, we will be expecting to a lot of tourists, and you'll often find these little pockets. So these a rise in the incidence of viral infections in general, cold viruses in general.
The H1n1 virus, this strain, this mutation as they call it, what makes this particular strain so, and I use the word deadly, very guarded?
Sure.
Right? I know we have to get into that as well, because it's not going to kill you just like that. But what makes this particular strain, press this panic button in us? Yeah.
So I think it stemmed from the 2009 pandemic, or the global epidemic, that it was associated with deaths, especially in younger persons. What usually happens, and in places such as in the United States, they may note as many as 36,000 deaths every year due to the influenza virus. So that happens annually. That happens annually. But especially in persons with weaker immunities, they may find that some of the symptoms which are relatively innocuous, like fever, body aches, headaches, chills, nausea, vomiting or diarrhea, those normal, well, I shouldn't say normal, but those classic symptoms associated with the flu virus or the influenza virus, in persons with weaker immunities, persons with coexisting chronic medical illnesses such as asthma, diabetes, kidney failure or cancer, they may find that it may progress into shortness of breath, pneumonia, and what we found back in 2009 is that many of the persons who died then had clots in their lungs. So whether or not as a consequence of being in the intensive care unit for a long period, or whether as a complication of this life-threatening infection, persons at extremes of age and pregnant women were particularly prone to the life-threatening complications. So most persons, and I think if I could just emphasize this, so in terms of dispelling some of the myths and fears, most persons infected with the influenza virus will make a perfect recovery. They will make a perfect recovery with fluids, rest, paracetamol, tender loving care, you know, your chicken soup and all those remedies of the past. Tender loving care at home, and you will make an absolutely perfect recovery.
So just to align myself with what you're saying, there should not be a mad rush for everyone to go for this vaccine. That's what you're saying? Once you are aware of your medical condition.
The persons who are most likely to run into the complications of influenza, such as a pneumonia or respiratory failure or lung failure, those persons, as we mentioned, with the chronic medical illnesses, persons at extremes of age, so let's say younger persons 6 months to 4 years old, persons who are more than 65 years of age, and pregnant women. I just want to re-emphasize that. Healthcare workers, persons who may be in the firing line, healthcare professionals should be priority patients. But having said that, though, Sheldon, there is a concept when we're talking about vaccines, and a concept when we're dealing on the importance of vaccination and immunization called herd immunity, in that you have persons who are unable to get a vaccine for different reasons. They may have had a reaction in the past to the vaccine. Persons who are very young, like persons less than 6 months of age, they're unable to get a vaccine for different reasons. And it is thought that if we vaccinate everyone, that those vulnerable members of the society will be less likely to get sick, because we will be less likely to get sick. So I am a proponent of universal vaccinations, that once we have the vaccines available, and I know that we've been hearing that they're freely available at the health center. There may be issues with stocks too in some of them, I've heard already, but I am a proponent of universal vaccinations. I'm a fan of it. So apart from those high-risk groups, but of course that we want to say that it would be almost mandatory that they should have it. Having that influenza vaccine annually should be something that we should be advocating nationwide.
I like that angle, and I like how you put into context that if everyone actually gets the vaccine, then it limits the chances of those in the vulnerable age group of spreading the virus. I really appreciate that perspective that you've placed on it. So just to re-emphasize once again before we continue, that you have a situation whereby it's not so much the virus in itself that is deadly, quote unquote, but based on your medical condition, it can cause death.
You may find that. You may find that. Now, certain strains of influenza tend tend to cause, tend to be perhaps more likely to cause by the complications of the respiratory failure, the pneumonia, and death. But the H1n1 was one of those examples back then. But as we said, that these viruses are changing all the time, mutate all the time, and this present form of influenza, which is also another type of H1n1, so, and it changes all the time, so almost every year, I would think. These vaccines are, most of them are about 60 to 70% effective. So they're not 100% effective. That's why the watchword remains prevention. You're trying to prevent infections, making sure that you know that you're exercising, that you're having a good diet, fruits and vegetables. You're trying to boost immunity as well too. So in someone who may be apparently healthy like your goodly self, you want to make sure that you're using hand sanitizers, you're staying home if you're sick. Persons who are sneezing or coughing, it used to be recommended you sneeze in your sleeve or you use some sort of a disposable tissue. Bearing in mind that the viruses can stay on surfaces for sometimes a few hours. So let's say like doorknobs can stay on the surface of desks.
So there's a critical window of opportunity for the virus to still spread and infect someone.
So despite the fact that a person may have exited a room, but they have coughed or sneezed into the atmosphere, they've sneezed into their hands, touching a doorknob, it might be a source of infection, might be a focus of infection, potentially.
Let's deal now with the conspiracy theories. And that's what the half-truths and innuendos, right? We'll deal with that.
Fake news is another thing, I suppose, that you've heard a lot.
So there are people who believe that over the decades or centuries, or that far, that there is this global conspiracy through the pharmaceutical companies to wipe out mankind and to wipe out certain ethnic groups, and the vaccines, the viruses are man-made, and then they're going to inject it into animals, and then the animal farmers, like a domino effect, they're going to use their products and put it on the shelves and kill people. So we can smile about it, but it's a real conspiracy. People are concerned. Even in some of my own research, it's like, okay, wow, questions. So I'm asking you, should people, what is the real truth behind the vaccines based on your knowledge?
So I think it's an excellent point. It's an excellent point that you're making here, though, Sheldon, and I'm hoping that our viewers would be aware that apart from the vaccine, there is a lot of controversy about one of the antivirals which is actually used to kill the influenza virus, and locally the trade name is Tamiflu. And you may have heard about that at the time of the 2009 H1n1 epidemic or pandemic. And there were a lot of allegations as well too that maybe once more the pharmaceutical companies were in cahoots with the World Health Organization. A lot of the medical journals actually question the value of it. Since and if I could also mention here, there is no rule for antibiotics in the management of a viral infection. So as we mentioned, it's tender loving care, it's fluids, it's rest, paracetamol, and of course if persons find that they're having shortness of breath or certainly a very high fever, especially in children, so if there are seizures, if they're having problems talking, confusion, many sort of misuse that might indicate problems with the brain, those are red flags that they need to present to hospital. They may need to be hospitalized at the level of intensive care. So shortness of breath, confusion, convulsions, a very high persistent fever, especially in children, one must be vigilant and have a low threshold for presenting for admission to hospital.
And antibiotics then will not work at that.
So antibiotics at that point for a viral infection are useless. But for persons with severe infections,
just for knowledge,
those antibiotics are geared towards killing bacteria. So bacterial infection. So it's a different organism, and they can also cause pneumonias, Persons who are infected with influenza can also get secondary bacterial infections. And sometimes we use that medication for the virus as well as the conventional antibiotics.
Okay, understood.
But at that point, for most individuals who have normal flu-like symptoms like the fever, the runny nose and sneezing and so forth, those the use of antibiotics, apart from being not indicated, it actually breeds resistant organisms when we use antibiotics wrongfully. So a lot of persons will sometimes go to the pharmacist or doctor and they said, and they will say, Doc, I must get an antibiotic, otherwise I don't feel good. But most times it's your body's natural immunity is fighting off the viral infection and you get better on your own. But at the same time, the germs are getting smarter, so they're learning about conventional antibiotics. And in the next few years, we don't want to have a separate pandemic of antibiotic resistance, where when we need antibiotics for bacterial infections, they are of no use. They cannot work. So those are the persons who will need to be hospitalized then, and somebody with severe infections, especially in the first 48 hours, there were specific drugs which were antivirals that were thought to reduce the likelihood of progression into some of the complications. There were a lot of theories about whether or not that was useful. The vaccines, as we said, they're not 100% effective. Persons are rightfully afraid, and in fact, but you will often hear someone saying, Doc, I had a neighbor who used the vaccine and they got a complication, they had problems, or they got sick after the vaccine. So a lot of the persons will say, Doc, I got the flu after the vaccine. And the truth is that it's a killed form of the virus. So you're not going to get the flu, you're not going to get influenza after the vaccine. The way that it works is a killed form of the virus, and it stimulates antibodies. It stimulates the soldiers and the defenders in your body to actually recognize it in the future.
So it is somewhat like, as we use the terminology soldiers, it is somewhat like additional help for the antibodies, basically.
So should you be exposed subsequently, should you be exposed, so let's say that you're exposed to somebody who is ill with influenza, your body will have those antibodies, those soldiers are present and able to defend accordingly. So the thinking is that you're less likely to get infected, and of course the severe, potentially life-threatening complications will not occur. So
there are those who will argue, and I'm asking these questions because, again, these are things that people will ask. Like one gentleman called a radio program and said, listen, I'm accustomed back in the day drinking my little bush medicine and all is well.
Yes.
Because, again, the body, we have our antibodies within our bodies. We have the white blood cells and so forth. So they're saying, okay, this is what our body was created for, to fight against diseases. Why do I now need to take a vaccine to assist? Why do I need additional help from a man-made vaccine? How do you respond to that?
But there's a lot of fake news, I think. Fake news. So around vaccinations in general, and in fact, I think if you read about places such as Europe and the United States where vaccinations are not mandatory, they're actually noticing a surge in infectious illnesses that we thought had been eradicated. So some of the older viewers would remember the horrible infections of smallpox, and that has been eradicated since 1977. So the last documented case was more than 40 years ago. And the World Health Organization has actually been mandating vaccines in so many of the developing nations of the world. But the measles, mumps and rubella vaccine, about 20 years ago, there was a doctor who published an article in one of the journals about a potential link with autism and measles, mumps and rubella. Now that article has been debunked by the scientific community since then. But yet you have a lot of persons still saying that measles, mumps and rubella vaccine is linked with autism. Places such as in the US, they are refusing to vaccinate. And they are noticing a surge in measles, something that we don't see anymore. because those vaccines are mandatory for children before entry to primary school. So I think that seeing the complications of measles, some of which as well too can be life-threatening. There are potentially life-threatening brain infections with measles. So it's not just an innocuous childhood illness. Many of the physicians in the United States are flabbergasted by the complications that they're seeing because of parents wrongfully keeping children away from vaccines that could prevent not just life-threatening, but it can leave children permanently brain damaged. So that's an example of some of the fake news and some of the long-term effects of listening to some of those crazy theories that you find on the internet. Now, a lot of persons will say that, Doc, I never get sick. I never get a cold. So I never get a cold. But remember that these viruses are changing. So remember that your body is changing as you age. You are more prone. Your level of immunity changes as you're getting older. Right. So your ability to fight infection is altered as you age. And you may find that although you were relatively well in the past, you may find that you are susceptible now. And to reiterate and to emphasize to our viewers the value of herd immunity, that if you don't get sick, it means that persons who are unable to take the vaccine will be protected.
All right, So
it's almost like a social responsibility if you look at it.
And speaking of social responsibility, let's deal with some questions which people may rarely ask. One, sanitizers. What should I look for when I'm purchasing a hand sanitizer? Because again, you have to look at the alcohol content. What should I look for? Because not everyone, some of them, you look and just the scent alone, okay, something just is not right here with this one. What do I look for? So what should be the red flag for me?
So the marketing strategies I know have varied. So a lot of it's a huge market now. So it's a huge market now in the world too. I use them. Most of the sanitizers will have perhaps 60 to 70% alcohol.
So I should look for that.
60 to 70% alcohol, and 99% of the germs and most of the conventional bacteria would be killed. Sometimes it's harder to kill all the viruses and all the organisms. So of course you may still get ill, but many women now will have sanitizers on their purses, clip-on their purses. Children are sent to school with sanitizers. So I think it's it's perhaps a useful tool in the armamentarium to prevent infections. Right. You can't beat good old soap and water when it comes to basic hygiene. Right. So especially if you think that, simple handshaking is a way that viruses and bacteria may be transmitted, although we're speaking specifically about the influenza virus. So a little plug as well for gas stations. So especially if you have to pump your own gas, make sure that you're sanitizing after the use of the pump.
I think some of them have it, but some of them actually don't.
But some of them don't.
As the case may be.
When you try there, but they don't have any alcohol, but they don't have any of the sanitizers at the bedside. Perhaps instead of drinking the alcohol too, you should be using it to sanitize. So that was just a little addendum there. So 60 to 70% of alcohol is found in most of the sanitizers, as we said, and try if you can't use soap and water, try to have it handy.
So would you say that, again, based on your information, that all of the hand sanitizers so far on our local market are reputable?
They should be, but they should be. But I don't think that the Food and Drug is able to regulate these. So I don't think that we would have a definitive yes or no answer to that, because a lot of these things are over the counter. In fact, but they're all over the counter, so they're not regulated necessarily as a medication would in a pharmacy, like an antibiotic would. So and many of these brands that they marketed, so let's say a superhero or some cartoon character in order to make them attractive. Some of them are scented as well, but to make it more acceptable for people. A lot of persons don't like to use sanitizers as they tend to dry your hands.
That's right.
So, so many of the sanitizers actually come with some sort of moisturizing effect too. But since alcohol is an astringent, it will tend to dry your hands, and persons with certain rashes in their hands may find that those are exacerbated subsequently. So they don't like to use the sanitizers as a result. So they can use a sanitizer and perhaps a light moisturizer, but chat with your pharmacist or doctor.
All right, just as we recap on this before we move on to another topic. So again, I'm making it very clear that when it comes to the H1n1 or any influenza virus, as a matter of fact, a lot of different factors must be considered. It is not a death sentence, as the doctor indicated, but based on your medical history and so forth, then of course priority will now stem as to who will get it first, but universal vaccination. He's recommending that so that those who are in the more critical area, they of course would not be infected by the virus. We want to move on now to the issue of dengue in Trinidad and Tobago. Recently there was a report that there's an outbreak of dengue fever in Jamaica, right? And we are neighbors.
Sure.
And so at this point in time, this dry season, should we be concerned about dengue fever in Trinidad and Tobago?
Usually we see a surge in the incidence of dengue at certain times of the year. So especially in view of the fact that the breeding sites for the vector of dengue, but dengue is an example of another virus. So just as the flu virus, you have different strains of influenza, dengue has certain types called serotypes, types 1, 2, 3, and 4. It's a virus which is spread by the mosquito, but the Aedes aegypti, and the female type of the mosquito. So you can actually identify it by the striped legs, and the breeding sites often are stagnant water, sometimes tires, overgrown bushes. Those are often areas. And what we know about the Aedes aegypti mosquito is that it loves our nasty country. We are a very nasty country, and
but just being honest here, remember this is not about half truths and innuendos. So we are a nasty country. Yes, Dr. Ford can say the same thing. We're a very nasty country. Go ahead, Doctor. Yes.
But that is why we see such a proliferation of the mosquito. Usually during the dry season, some of those breeding sites will not exist, so we don't often see as many cases. But with just off the latter part of the rainy season, so of course we had incidents of flooding too during this time. So around October, flooding was widespread and devastating. So a lot in the news, leptospirosis, of course, another infectious illness spread by rats' urine, and that's always something to be vigilant about throughout the year, since it may be associated with fatal liver and kidney complications. So leptospirosis, dengue, so associated with the potential for bleeding and dengue shock syndrome. So they have severe forms of dengue. But during the dry season, we may not see so many patients, but it's important that it's hyper-endemic. And I think that that's a term, just as we use the term pandemic, meaning a global epidemic, which is a surge in the number of cases, hyper-endemic means that it's always present at a high level in the population. So the symptoms and signs may be very similar to the influenza virus: fever, body aches, pain around the eyeballs, headaches, nausea, vomiting. But with respect to dengue, some red flags for viewers that you may actually need to seek a higher level of care might include pain in the abdomen, severe abdominal pain, the upper part of the abdomen, persistent vomiting, confusion, restlessness, shortness of breath, swelling to the abdomen or the legs. Those are some red flags or warning signs that you may need to present to hospital for blood investigations, further testing, so aggressive fluid replacement. So, and of course, the management of that does not involve antibiotics. It's a virus, so it involves liberal fluid intake, paracetamol to control temperatures, especially in children. Children 6 months to 5 years are prone to febrile fits, fever fits, so if their temperatures get too high. And Bed rest. So bed rest, fluids, and paracetamol.
The incubation window period, let's say you were infected with the mosquito to the point of exhibiting symptoms. What kind of window are we looking at here?
So it can range between 4 to 10 days. So persons infected after the bite with a female Aedes aegypti, which means then that once more with the influx of visitors into the country,
about that, yeah.
the influx of visitors into the country, persons infected not just with the dengue virus, but there was the chikungunya virus a few years back, and Zika,
as well.
malaria too, in places like some of the South American neighbors coming into the country. They may be potentially infected with these viruses and germs, and the organism that transmits the virus is present in this country. Malaria, it's a different type of mosquito, but the Anopheles mosquito, we've been noticing a few patients lately, and the Ministry of Health a few weeks back made a statement that there have been patients with malaria but diagnosed locally, but usually persons who may have traveled to Venezuela or to Guyana and then returning to Trinidad. That incubation period is longer than dengue. So with some persons it can actually extend to many months. So they get infected and then start showing the fever and chills and symptoms of the malaria subsequently on return to Trinidad.
You know, I'm processing everything that you're saying, you know, over the last few minutes. And this is a general question in terms of our management of healthcare in Trinidad and Tobago, with all the shifts that are taking place with different diseases and so forth, different strains and mutations and so forth. Are we moving as quickly in terms of our management with as fast and as rapid as the viruses are multiplying? Are we in a good place, or are we still playing catch up?
So it's a lovely question. I think that we tend to be reactive rather than proactive. Having said that, the Ministry of Health over these decades has put a wonderful vaccination program in place. And the fact that it's mandatory, and the fact that many of these vaccines are now mandatory, such as tetanus, measles, mumps and rubella, polio, we don't see these horrific illnesses, these horrific infectious illnesses in most of the West Indies, I would think. The flu shot is not mandatory, but the influenza vaccine is not mandatory, and that's why we will often hear a lot of persons being unsure about it. Perhaps you would have heard a lot from the gynecologists about the HPV vaccine, which is used
yes.
So my good friend and one of the the writers in the Express that I read actually nowadays, so one of the columnists that I read, and so those are not mandatory, but they're excellent tools to prevent infectious illnesses. So I think that the watchword remains prevention though, and I think that depending on legislation, depending on the government for things such as keeping your surroundings clean, trying to eliminate potential breeding sites for the Aedes aegypti mosquito, persons also have to shoulder personal responsibility.
And that's, I think,
must have your own responsibility.
We create our mountain of problems. When I see these mountains of rubbish piling all over the place, and we can prevent so many diseases and viruses if we just really do our part. You mentioned about pregnancy, and I want to just stick up and just return just briefly to the H1n1 again. You said pregnant woman.
Yes.
Again, they would be listening and they may be apprehensive. Okay,
Yes.
Are you sure it is safe for someone carrying a child? How do you respond?
Certainly, and these vaccines are not just safe, but in all the trials which have been done with flu vaccines worldwide, the pregnant women actually represent a high-risk group. So that's almost a group that is recommended. It's almost mandatory that they should have a vaccine. So I know at the San Fernando hospitals, so I work there, and I know that at the antenatal clinic for pregnant women, that is an option for them. So at clinic, it's the ideal opportunity. And it's something perhaps at the health centers that instead of having a different day for vaccinations, perhaps the health centers nationwide can think about that day in which you're dealing with women in their stages of pregnancy.
That you implement the vaccine.
You should have the vaccine available. Okay. So it makes it more convenient for these expectant mothers to access the vaccine at that point.
And time is managed better because now you free up other days for others who will need the vaccine as well.
Perfect.
Right. And as we kind of wrap things up, I know that there were 3 deaths. I know we kind of go into much details about these 3 H1n1 deaths, but based on your observation and of course what you've seen and what you heard, these 3 cases would have had other complications as well.
One of them, at least, which was documented in the mass media. So one of them seems to have been diagnosed with diabetes, and I think was also asthmatic. And many of these respiratory patients, and that was seen. So a lot of the information that we know about the so-called swine flu virus, or the H1n1 virus, stems from that 2009 global epidemic. A lot of research went on subsequently worldwide, not just locally but worldwide, and most of the patients who died had some pre-existing illness, and especially a respiratory illness. Somebody who had a history of smoking, chronic obstructive airways, perhaps asthma, or a chronic medical illness such as diabetes that caused a weaker immunity was more likely to escalate into a pneumonia or respiratory failure. A second risk factor too, which I think it's important, since I know that you're a fan of dealing with these chronic medical illnesses, a second risk factor that was found back in 2009, and it might be applicable to these recent deaths, was actually increased body weight. So the separate global epidemic of obesity, and we know that obesity itself can be classified as a disease. So obesity, apart from lowering immunity, is also going to increase the likelihood of diabetes, hypertension, heart disease, strokes, and so forth. And we noticed that in some of the patients who unfortunately died at the intensive care units in 2009, that seemed to be a recurrent risk factor for persons not just acquiring the influenza virus, but developing pneumonias, getting clots in their lungs, and subsequently dying from the infection.
When you're speaking there, I'm so amazed because what I'm seeing in my head is that sometimes we so focus on the front door, but we leave the back door open. I think when it comes to obesity, sometimes we're thinking, all right, you have a little weight, but it's okay. And you're thinking that I may not be infected by this particular virus, but you leave that back door open for the virus to come in, and that's what they're saying, because people may not think that this is an opening or a gateway.
That is a separate risk factor.
Yeah,
that is a separate risk factor. Although you're thinking about, as you said, so a little extra fat around your tummy, perhaps you've been warned about the problems of diabetes and hypertension, but the increased susceptibility to influenza is something that has been noted worldwide, and the increased possibility of life-threatening complications from the influenza virus, but the H1n1 virus.
Wow, we could go on and on and on and on and on, but we're gonna put a plug on this interview for now. But this is just part one of many to come, I'm sure. Whether I have to come up, of course, if he's not too busy to join us on ACTN Studio. But always a pleasure. A wealth of information from Dr. Teelucksingh there, and I do hope that we spend it wisely. Yeah? That's the key. We spend it wisely, we use it wisely, and of course, prevention is always better.
Better than cure.
So any closing remarks from you, Doctor?
Well, I think that you summarized it beautifully, Sheldon, that I think that the watchword is prevention. So your health is indeed in your hands. So of course there are many modes of dealing with infections like these. So enhancing the level of immunity, healthy diets rich in fruits, vegetables, nuts, peas and beans, low-fat foods, making sure that you're getting regular exercise, perhaps 30 to 60 minutes of exercise daily, so avoiding stress, stopping smoking. Those are all facets of increasing someone's level of immunity so that you're less likely to get some of these infectious illnesses that we discussed. Some of the transmissible illnesses due to mosquitoes, that burden must also fall towards the general public. We cannot depend on the legislators to keep us healthy. So a healthy diet as well as exercise, trying to lose weight, those are excellent resolutions, I think, for 2019. Maintenance of a healthy lifestyle will make sure that you look after yourselves so that we won't have to. Yeah.
Doctor, a pleasure. All the best to you.
It's
and
a
of course,
delight.
we'll meet again, I'm sure.
Thank you, Shana.
Thank you.